Good afternoon and welcome to our Learn at Lunch webinar. Today we will hear from Dr. Matt Brosi as he discusses ways to manage the stress that many producers face. You may ask questions through the chat window during the presentation, and you can open this window by clicking the chat button at the bottom of the screen. Additional farm management resources may be found on the eFarm Management page. I will share this link in the chat window. Our next Learn at Lunch webinar is 1 week from today on October 3rd. It will cover the profitability of value-added calf management practices. I will share the link to register for it in the chat window as well. Dr. Brosi, I will turn it over to you now.
All right. Well, thank you so much for giving me the opportunity to speak to the group today on managing farm stress. My name is Matt Brosi. I'm a professor of marriage and family therapy at Oklahoma State University, and also a professor and also a state extension specialist. So I've done a lot of work addressing a number of different issues related to families and family systems and mental health, and been working with some colleagues the last several years addressing farm stress specifically. I want to say thank you to some of my collaborators as well. Dr. Shannon Farrell, who I believe is on this webinar, he's professor of Ag Econ at OSU, and Jordan Schuler is a doctoral student in human development family science, has helped bring a lot of this attention of farm stress together and supported a lot of the materials that we'll talk about today. All right, so first and foremost, why is this topic important? We've been doing a lot of meeting with a lot of different groups on addressing issues across the state. And first and foremost, we know that mental health issues are very common yet severely overlooked. The question is, why do we continue to struggle so much in not bringing as much attention to the issue of mental health? And across the board, there's just a general lack of understanding. There's maybe a fear of addressing mental health issues. An unsureness about what mental health issues entail, what they look like. It's led to a lot of cavalier attitudes towards addressing mental health. And a lot of folks, I think, believe that it's something that happens to others, that, maybe you don't have a personal connection to a mental health issue, or maybe you don't have a family member that is dealing with or struggling with a mental health issue. Having a mental health issue for those individuals that do struggle can be quite stigmatizing. It's oftentimes misunderstood. So something as simple as a major depressive disorder, it manifests itself different in different individuals. For women across the board, it looks more traditional in terms of the symptoms that you might see in terms, issues with sleep or mood or lability, things like that. But in men, it looks very different. It may look more like irritability or expressions of anger. And so as a result, it's a lot of times invalidated within ourselves, within others, or even judged. And so it leaves a lot of folks feeling like it's better to battle in silence. This is where I come into play in terms of, so what do we do about all this? Why is this issue important? And we know that simply raising awareness of mental health is only part of what's needed. It doesn't, what happens is just talking about mental health is one step, and I think it's a great step in the right direction. And so we've got a lot of initiatives talking about farm stress and mental health issues specifically, but it doesn't help explain how problems form, nor what resources are available to mobilize and address them in the most effective ways. And what we know is that psychotherapy is certainly effective, but a lot of folks aren't mobilizing that resource specifically. We're not using those resources. We may not have those resources available as well. And so our desire through a lot of the initiatives that we're trying to bring through extension is to help individuals and families and communities, but also industries in building and implementing resources to address mental health issues. So there's a lot of things that we can mobilize at different levels of the system. I'm a marriage and family therapist by trade. I'm a licensed clinician, and so I do a lot of work, at the real micro local level with folks and trying to help them, overcome mental health issues or, reduce symptoms. But I'm also empowered, excited and passionate about helping family systems address mental health within those smaller units, but also within communities. And so helping folks mobilize, relationships at different levels to address mental health. So what about Oklahoma's mental health crisis? This is just an accumulation of a lot of what we're seeing nationally. These are, individuals experiencing mental health illness. We're third nationally. Oklahoma in general, I say this a lot, Oklahoma is not okay. citizens experiencing a serious mental illness. So we're talking about, some major depressive disorders or acute psychotic features, things like that. We're second nationally. We're not doing well in terms of substance abuse disorders as well. So methamphetamine use continues to plague us in terms of overdose deaths. Marijuana happens to be towards the top of the list in terms of folks seeking drug treatment. Adverse childhood experiences per person were first nationally, and so that's an accumulation of what we call ACEs, those adverse childhood experiences, being raised in a domestic violence, violent home by somebody struggling with substance use disorders, divorce. There's a lot of things that stack and accumulate, and what we know in the research is that when those items stack, it leads to health disparities later in life. Adolescent diagnosed depression, 30%, 33% increase. Adolescent suicide attempts, 23% increase. Adolescents completed suicides. So we're seeing a lot of the trickle down effect in terms of addressing other family members and where adolescents are specifically in terms of mental health issues as well. That leads us overall in Oklahoma about the bottom of the barrel at about 49th in the nation. And we're seeing a lot of other additional issues affecting rural communities as well. So let me show you the next slide in terms of overdose rates. So I pulled some data in terms of the percent of folks reporting frequent mental distress in Oklahoma. And this is just a slide showing kind of the hotbed of, the darker areas represent a greater frequency of reporting. And one thing to note is that you see kind of the lower southeast region of Oklahoma struggling a little bit more. But 7 of the top 10 counties in Oklahoma struggling with frequent mental distress are actually rural counties. We know that Oklahoma is second in the nation also for substance use disorders. And so that's kind of pointing at what mechanism and means are folks utilizing and mobilizing to deal with mental health issues as well. And so we're seeing an uptick of substance uses. Same resource, pulling a different slide in terms of where are the most mental health providers in Oklahoma. And if this shows you anything, it's showing you the top 2 or 3 counties in Oklahoma where the mental health providers reside. And we're pretty much looking at Oklahoma County and Tulsa County are at the top. And what this really points out, and if you isolate it a little bit more and you just point to just psychiatric care, it really only highlights Tulsa and Oklahoma County across the board. So what this is really pointing at is that adults residing in rural locations are receiving mental health treatment less frequently and less often with providers with less specialized training compared to those in urban areas. And so we've got a lot of folks outside of these urban areas that are going without specialized treatment. Now, what's going on top of that? Stigma continues to plague Oklahomans in terms of seeking out care. Still a lot of shame and privacy issues are fierce and rampant in terms of, this is something that we want to struggle with, as individuals, or maybe we struggle with within our family systems. So seeking out support is less common. There's a lot of fierce independence and what Shannon and I would call toxic grit. So there's that grit mentality that, we can get past this, which is, oftentimes the case. However, it's the interim that leaves a lot of people struggling. And it keeps people from seeking out help. So in terms of farm stress, what we know is that farming is amongst the most stressful professions across the board in all kind of working industries. There's a lot of factors affecting that. Financial stress across the board happens to be one of the top stressors. Dealing with low income, high interest rates, foreclosures, increased input prices. There's a lot of factors affecting the financial burden on farmers. Dangerous conditions across the board as well, lack of control, equipment failure, damaged property, drought, you name it. There's a lot of wildfires affecting different regions as well. Those all are issues that are compounding on top of one another, just making it that much more stressful. And so when individuals are lacking those resources available to effectively deal with stress, it leaves people kind of in a lurch. The rural communities are also affected specifically compared to urban, that folks are actually in dealing with a lot of isolation and privacy issues, and this compounds on top of itself. And one of the things that we learned through COVID was that isolation is kind of the almost a death blow in terms of folks knowing what resources are available and then reaching out to those resources to utilize. There's a lot of higher level long-term health problems in rural communities as well. And when you start adding that onto poor infrastructures within those rural communities and insufficient health care kind of availability, it just adds to the process. And then that leads to that last bullet, the restricted access to quality health care too. So a lot of folks are needing specialized care that don't have access to those specialized resources. And so you may be left with more of a general practitioner type resources is available. Farmers and suicide, we know that suicide rates are higher in rural communities and the gap is actually growing. There's a lot of concern about what's happening in terms of, maybe a plateau in more urban areas. It's increased over the last 10 years across the board, but it's actually plateauing and stabilizing in rural and urban communities, but it's not in rural. The rural community suicide rates continues to grow. Oklahoma across the board is sixth in the nation for suicide rates, and I wanted to present on this is a lot of folks ask me, who are the ones that's first through fifth. We're actually behind Wyoming, Alaska, Montana, New Mexico, and Idaho, and those are five other pretty significantly rural communities and rural states. Oklahoma suicides increased 8 to 10% in 2020, and that's across a 10-year span. But we saw rural increase had a 27% increase. So that's how serious this is. Specifically for ag and suicide, we're fourth highest industry segment for suicide. And if you break it down a little bit more, we're seeing a lot of men specifically affected by suicide in comparison to women. In fact, I just looked at some stats this morning, and it looks like rural women actually have a lower suicide rate than women in urban areas. And so the direct opposite is true, though, for men and the ag industries and rural communities. There's a shift, though, for men specifically. What we used to see is that men in their middle age used to be at the highest risk of suicide, but that has recently shifted to younger men in their 20s and 30s, and older men, age 85 and over, being at the greatest risk. And if you add on the veteran status on top of that, it's even worse. So if you're a veteran farmer, you're at a more increased risk. And the question is, what's going on? There's an accumulation crisis of additional stressors and crises that folks have been affected by. Depression and suicide on the farm, what's going on? There's a lot of uncertainties, and those problems are stacking. So it's a compounding effect, a lot of that lack of control. When you add on a lack of social support and more isolation compounded by this grit mentality, it leaves folks kind of being pushed into what I consider a crisis level. And so what happens is people are looking for solutions, but not having those available resources to mobilize. And that brings me to kind of what we call the acute crisis. And so what's happening is suicide risk is really most of an issue around what we call the acute crisis. Is when folks have been pushed into a corner looking for a solution. Without those resources, it leads to a lot of greater increased thoughts about suicide, where folks are starting to develop a serious plan or a specific plan. And then when you add on the available lethal means, that just makes it even worse. And so we're specifically talking about what specific resources would individuals utilize to take their own life. So some of the initiatives that we're trying to address here in Oklahoma is first and foremost raising awareness about mental health issues. We've got mental health first aid trainings that are available across the state. Those trainings don't necessarily have to be in person. They're available online through web-based formats. So we're encouraging as many people to become certified in mental health first aid. We've got some folks in the state that are delivering those programs. We've actually started taking some strides towards addressing mental health first aid trainings for youth as well. So we've got a lot of resources to start addressing a greater range of folks. And if you start thinking about where those youth are, we can plug them into 4-H programs and FFA programs, and help get some of those leaders out there continuing to deliver the message about raising awareness about mental health. We've also got Project Echo across the state, and the Project Echo is mainly for providers to know how to address different issues related to mental health. We're also exploring how various entities within the ag industry can improve well-being in rural families and communities. Our goal is to arm as many citizens with the resources to provide support and to respond to mental health issues as well as suicide. So training as many folks across the board, and this goes well beyond just folks in ag industries, but it's maybe ag mediation, maybe the clergy, maybe different business professionals that we can mobilize to be all on the same page. And our goal with this is to address issues preemptively, reducing the need for intervention. I work more on the intervention side, in the mental health issues and, doing therapy. But if we can do more preventative measures and mobilizing some of those resources, we can get ahead of this a little bit more. And we also know that because not every family and community has the same resources, my job is to help families learn skills to strengthen their relationships. I believe concretely that the best therapist that a kid can have is the parents. But sometimes we got to help those family systems communicate more effectively, to start asking better questions so that we can stave off crisis. We've got billboards across the state now for 988, and I'll talk about that here in a little bit. That even cowboys cry, but every time I see those billboards, I keep thinking to myself, yes, but you got to ask yourself why those cowboys are crying in the first place, and maybe that intimate partner can be a resource to that individual to help stave off some crisis. Maybe we can increase communication between those individuals to help address those needs. So that brings me to kind of the culmination of this presentation: is where do we start? First and foremost is, we can only be a resource to others if we're taking care of our own stuff. And so self-care 101 is what this is all about. My goal is to help people put their own masks on, to kind of address their own burnout issues, start asking those better questions about: where do I feel out of control? Where do I feel I need resources? How am I taking on too much and not attending to those other things? So I can be the best mediator, the best business professional, the best husband or wife or partner in those relationships. So I can be the best parent to my children who are dealing with their needs as well. Helping folks attend to both adaptive and maladaptive coping means. We know that stress builds up, and we sometimes get overwhelmed by stress, and we get to that breaking point, and we engage in adaptive mechanisms, which are maybe sitting down at a kitchen table and saying, okay, honey, this is what I need to address. This is where I'm at. Or calling up a colleague who's on a neighboring farm and saying, hey, I've reached a crossover point. I need some help. But also engaging in maladaptive coping mechanisms. And so we do a lot of stupid stuff to deal with stress. And sometimes those things that we engage in might be overeating, might be stress eating, or maybe using substances, or binge watching TV. What that's keeping us from doing is addressing that burnout process effectively and closing off that stress response cycle. My goal is to help people attend to relationships within families, as parents and as couples as well. So to do our own work so we can be the best for helping those that we serve. One of the things that we're trying to do is help folks to break the ice and reach out to those that you serve. You're in those ag industries, you're in those communities of interest. So think about the way that you can mobilize mental health awareness with those people that you serve. It's not just a questionnaire that we fill out at the doctor's office to say, have you been dealing with stress, or are you feeling depressed? But we should be asking those questions of everyone that we're working with, because we care about them. One of the stats that came out of a study out of K-State several years ago is that we know that folks can correctly identify depression. So we know what it kind of looks like. We know when people aren't themselves. But the problem is that many people don't know what to do about it. And so we're trying to help bring some awareness about what we can do specifically. And that mental health first aid training is one of those things that can help mobilize some of those resources. So we also have trainings on called QPR, Question, Persuade, and Refer. So when folks are dealing with suicide and suicidal ideation, the best thing that you can do is ask. And so just ask somebody, how you doing? Or you ever thought about, taking your own life, or engaging in self-harm? Persuading those folks to get those resources that are out there and referring them on. We also want to pay attention to some things around lethal means reduction. And so some of the initiatives, and I'll just be blatantly bold on this, some of the newest strategies that we're seeing implemented is that we'll put the suicide hotline numbers on a gun case. And so maybe put a sticker, the suicide hotline number, on a gun safe. So we got a lot of access to lethal means in our state. And so one of those things is maybe starting to have conversations about, man, can I get some of your firearms out of your home? Can I help, if overdosing on drugs is one of the things, can I help start asking some questions about your access to opioids or unused opioids? Encourage utilization of some of those resources that we have available in the state, such as the Oklahoma Agricultural Mediation Program. That has a built-in system and a built-in program to help stave off crisis, to help come up with solutions to maintain that farm, that business, to help mobilize other resources that people can have access to. And then implementing proactive programs to address well-being as well. Engage in mental health coalitions in your communities, register for mental health trainings, mental health first aid trainings, educate one another on trauma-informed care, start having conversations about what ACEs are and how those affect all of us. Here's your general resources on where to find help. And the takeaway with this slide is put these resources in your phone contacts list. The best thing that you can do is start talking about 988, and that's a suicide and crisis lifeline, and they'll point you to resources in your community. It's available. I'm a big proponent of utilizing in-person mental health services as well in your community, whether it's a counselor, a marriage family therapist, or whether it's somebody in the clergy that you trust. Maybe it's a farmer down the street that's had success in their own lives. But we also have telehealth services available as well. And so there's a lot of folks that have the ability to reach into your home and provide mental health services on the internet or through a laptop. National Alliance on Mental Illness is an available resource, and this is specifically geared to help individuals who may not be struggling themselves with a mental health issue, but they have a loved one that's struggling with something like depression or anxiety or bipolar disorder. Knowing how to help them in the best way possible. We've got a lot of distress helplines available, crisis helplines. The one thing that we saw as an uptick through COVID was also with domestic violence and child abuse. And so I want to make sure that everybody has that resource available. It's a 1-800-522-3511. So if you have questions, everybody in the state is a mandated reporter. So our goal is to help prevent child abuse and neglect. And so if you need to call that hotline, that's available. And then the Oklahoma Ag Mediation Program, their website is available here. It's oklahoma.gov/OAMP. So reach out to them if you have any questions. The folks there are fantastic. Mike Mayberry is the executive director, and Cheyenne Sparks, who I think might be on this webinar, she's available as well. Some of the initiatives that we took on a couple years ago was to create a clearinghouse of available resources and start to address mental health in different ways. So if you, the extension webpage for farm stress is up there, and this is what Dr. Farrell and Jordan Schuler and I put together. But we've got a number of different resources available, and some of those are specifically addressing an introduction to mental health. So if you're not able to do the mental health first aid training, it's a longer training, about 6 hours, give or take. If you're not able to do that, I have a great presentation here on what's just an overview of mental health issues. But we've got additional resources on how to manage stress through mindfulness techniques, or how to communicate as a couple around stress, or how PTSD specifically affects farmers in rural communities. We've also got a nice presentation on suicide awareness and prevention as well. So these were all put together by mental health professionals. And so we're continuing to build on these resources. We got some tip sheets that's available as well. So check this out. If you don't know how to get to that website, just Google OK State and then farm stress. So just those three key terms, OK State, farm stress, and it'll get you to our website. So I want to say thank you for at least giving this initial kind of an overview of mental health and farm stress. If you've got any questions, certainly reach out to us. My name is Matt Brosey. I'd be more than happy to address any questions that you had, or if you want to learn more about how we can collaborate on putting together a better resource list, certainly reach out. I'm matt.brosey, matt.brosi at okstate.edu. We've got a webinar survey that's available here, so if you click on that, we'd love to hear from you. So we want to say thanks for attending, and I'll turn it back to Brent if anybody's got any questions.
Thank you, Dr. Brosey. I have it set where people here, participants can unmute themselves to ask a question, and you can also ask questions through the chat window. I have shared the links to the webinar survey as well in the chat window, and then the links to the farm management page and links to register for the next webinar.
Very good.
And let's see, so that's all available there, and everything's set up. So feel free to unmute yourselves if you want to ask a question of Dr. Brosey, or type it into the chat window. And as I mentioned before the webinar, we have our next webinar scheduled for a week from today, October 3rd, and it's going to be on value-added calf management practices. Dr. Eric DeVries is going to present that as well.
Dr. Brosey, Dr. Farrell, fantastic job. especially in the time span that you had. That was a fantastic overview. This is not a rhetorical question. You know this probably better than I do. I know that at least at some points in the past, we have had some folks on staff, at least here on campus, that were able to do the mental health first aid training. Do we have anybody out in the field that we know of that's certified to do training? If someone wanted to reach out and say, hey, I'd like to do a mental health first aid in my county or my organization.
So Kelsey Ratcliffe and Megan Monteith are two extension coordinators that are doing the mental health first aid, and they are available. I believe if you had a group of folks that wanted to put together a training, I think they would be more than happy to come to your community to deliver that program.
I'd really encourage folks to think about doing that in your area. We've had a few of those trainings here on campus, and very specifically, we had a training for folks that are student facing. So for some of our, College of Ag organizational advisors, so the folks are going to be out there seeing the students. But if you're an extension or if you're a part of this webinar, you're probably part of a junction point where you see a lot of folks in your ag sector come by you. And one of the things that Matt and I have talked about for a long time is making sure that we have people positioned at those junction points that can recognize the signs of mental health concerns and get those folks to help. In the context of first aid, it really is that concept. If I can catch you when you've got a little bit of a cut, okay, we can probably take care of it fairly readily. But if that cut continues and you've lost a lot of blood, or now you've got an infection, I've got to get you to a trauma center. I've got to get you to a hospital. And it's that way with mental health disorders. The longer they go and the deeper they go, the more intensive the treatment that's needed. So the sooner we can get folks to help, the better.
Are there any other questions today? Thank you, Dr. Farrell. I'm looking through the chat now, and I do not see any other questions. So I think I am going to end our webinar for today and wrap this up. So thank you everyone for joining us, and we'll see you a week from today, October 3rd, for our next Learn at Lunch webinar. Thanks again for joining us. Thank you, Dr. Brosi, for presenting, and we will talk to you later.